Yo.
Hi.
David, how are you?
How you doing? Hey, look.
Nice to see you.
Hey, nice seeing you. Hey, I greatly appreciate you waiting for me, man. I was 12 and a half hours of operating. You know how it is.
I know how it is.
I'm Dr. David Matlock. I'm a gynecologic surgeon, and I also do liposculpting. And I'm here today as a patient to see Dr. Diamond for a blepharoplasty to take care of my upper eyelids, which I'm having a problem with. At the end of a long day of surgery, I feel that my eyes are just tired, heavy. It's not a concern about aesthetics. It's a concern about just how my eyes feel at the end of the day. And I really even think it affects my vision per se, you know, at the end of the day.
This is just something that comes with age, the excess skin on the upper lids, and it's a known fact that people, when you engage somebody in conversation, the first place you look and the first place they look is right here, right at your eyes. And, you know, you're in the limelight, you need to look your best.
Right.
Dr. Matlock's been at the top of his field as a surgeon in Beverly Hills for many, many years. He travels the world and lectures all over the place, and he's a very high-profile person.
This will take a good 5 or 10 years off you in a very, very safe and effective manner, very natural manner. We'll make a fine little incision in the normal eyelid crease that you have. There will be no visible scar. We'll just excise the extra skin.
Dr. Matlock is going to have an upper eyelid blepharoplasty, which is essentially removing the excess skin of the upper eyelid. And this helps to create a refreshed appearance and create a younger look.
This is actually one of the first things that a lot of young people come in to see me for.
What my friends and family think, you don't need this. What does my daughter think? You don't need this. What my girlfriend think? You don't need this. They don't think you don't need that. But, you know, it's something that I want.
I won't want you exercising for about 2 weeks.
Okay.
So that might be tough for you, but that'll be probably the hardest part for you. We take the stitches out Tuesday. You can go back to work Wednesday.
Okay.
I probably would hold off on operating until at least Friday, preferably the following Monday if you can. He's kind of a turbocharged kind of guy. I'm afraid he might try and get back to work, maybe get back to exercise a little bit earlier than I would otherwise want. So I'm hoping he'll behave himself.
I'll do the right thing.
You're gonna do great.
All right. Thank you very much. I appreciate it, okay?
Yeah.
Today's the day of my surgery with Dr. Jason Diamond, and I thought, you know, to kind of relax myself and take my mind off of everything, I scheduled a liposculpting procedure prior to having my surgery. So as soon as I'm finished with the liposculpting procedure, Dr. Diamond will come up, and we'll go at it.
Good morning, Dr. Matlock. How are you?
How you doing?
You ready to go?
All ready to go.
You don't have any procedures scheduled for later in the day, do you?
No.
Good. It did not surprise me at all that Dr. Matlock was in here operating this morning before his surgery.
I have to be honest. Now, I have 42 patients on Monday.
22 patients on Monday?
42 patients on
42
Monday.
patients on Monday.
Now, the thing is, I have people coming from the UK,
Yeah?
and other parts of the world. Now, can I just see those new patients?
Look, you're going to have stitches in,
Yeah.
and I just don't want you straining or doing too much. We don't want there to be any risk of those incision lines breaking open.
Right.
You can see 3 or 4 new patients, and that's it, you know.
Well, okay. I wasn't going to tell you, but I'm glad I talked to you. I wasn't going to tell you I was going to come in and see 40 some of my patients.
Somehow I know you've got some plans to do some crazy stuff. That's the problem with taking care of doctors. I'm fairly concerned that Dr. Matlock may not be the most compliant patient in the world. He likes to go, 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 and he's already planned to have a surgery day 4 days after the surgery, and I told him it's really not a good idea.
Are you okay?
Your pressure is 146 over 86.
And that's it should be about
Heart rate
110.
97.
Yeah, I'm nervous. Being a doctor, I really know and understand the risk of surgery and anesthesia. It bothers me, and I'm scared.
But I need
God, I didn't know how bright those lights are.
Yeah, go ahead and close your eyes. Making the markings is the first step in getting this procedure perfect.
What's my heart rate?
Jerry, you can go ahead and give him some Demerol. We're gonna go ahead and get you a little bit groggy here, okay? And once that's in, then I'll inject the local, okay? It'll be very little. Even without the Demerol, you wouldn't feel this much, but we're gonna give that to you. And you shouldn't feel much at all, okay?
All right. Not too much, Jerry.
Right.
My blood pressure is starting to rise. I'm fearful of the anesthesia, and the bright lights are bothering me. Damn, Jerry. I feel it now. What was that?
It's very classic for doctors to be sort of control freaks, and even while he's lying on the table, he wants to know what his heart rate is, he wants to know what his blood pressure is, he wants to know exactly what he was given, and you know, he's a typical doctor. That's how I would be, that's how just about any doctor would be. David, I'm gonna get started. If you feel anything, you let me know. Otherwise, I don't want you talking, okay? Just great. I'll take the pickup. Right now, we have made the incision around the extra skin that we're going to cut off, and now we're just elevating and separating that extra skin from the underlying tissue that we're going to remove. Good. Okay, so we've removed this extra strip of skin right here, and this was just extra heavy skin that was taking up space. Now that that's gone, we'll suture this right back to where it was, and this is going to look perfect. That's going to take 5-10 years off in a very natural way, very conservative. He'll be very happy with that. We're done with that side, David. We're going to go ahead to the other side.
Okay.
Upper blepharoplasty is one of the most common procedures performed in all of facial surgery, and that's going to get rid of all that heavy tissue that was hanging down. And I expect this is going to give him exactly what he wants, which is just a natural rejuvenation of the upper eyelids. 2 more stitches to go, and then we'll finish up with the right.
Doing very well. Your heart rate went down from 90 to 80.
I don't feel anything when he's working. I don't feel any pressure. There's no pressure. It's really an amazing thing, though.
Anytime you operate on a doctor, there might be a little more pressure than operating on someone who's not in the medical profession. But the main differences are that with doctors, they tend to want to stay in control, and oftentimes are very bad patients. It's just a known phenomenon, and it's something that we have to deal with Dr. Matlock. He did great during surgery, but I know he's going to want to get back to work earlier than I recommend. It's an absolute pleasure.
All right, thank you.
All right, so I'll check up on you. You'll be around tomorrow?
Yeah, I'll be at home.
I'll call you at home. If you need anything, you know, you got my cell.
I know,
You just call me anytime.
All right, I appreciate it. Good job. I really appreciate it.
Yeah, it's a pleasure. It's an absolute pleasure.
My surgery's over now, and Dr. Diamond said it went well, so I feel good, feel relaxed.
I'll
walk out.
Well,
We're not supposed to.
I know you're not legally. You're not supposed to.
But then I own a place, so who am I going to sue? Myself?
Well, in any event, let me at least wheel you on part of the way.
I don't want to wheel off of the way. I want to walk out, head up.
No.
Come on, let's go.
Okay. Keep your head up.
Yeah.
Keep your head up.
All right.
Okay.
Where's Dr. Diamond?
Dr. Diamond is probably in surgery.
It's been 2 weeks since my surgery, and things have gone absolutely fantastic. You can hardly see anything. There was absolutely no bruising. Dr. Diamond didn't want me to work out for 2 weeks. By 7 days, I was working out.
Nice.
All right. You look good. Today we're having a swim party, bikini party. We do these things all the time during the summer.
Let me look at you without the glasses. Oh, yes. Now I see it. Now I see it, really. It looks natural.
At the end of a 12-hour operating room day, my eyes felt heavy. I don't have that problem anymore. I feel at the end of a 12-hour day just as fresh, as far as my eyes go, as I did when I started at 7:30 in the morning.
Where's the man?
I don't
I
know.
think he's behind the grill.
Dr. Diamond's coming over today, so I asked him, could he do a little Restylane in my smile line and some Botox for the frown lines?
This is what? No. This is Botox. Okay. Okay, here comes a little pinch right here, okay? Not bad? Not bad. Good.
Now, since I've been a patient, I have a better understanding for the patient.
Already, man. Looks great already. God.
Dr. Diamond lived up to my expectations 100%. You know, I had no doubt. I had no doubt. Unbelievable.